Microneedling is known for transforming skin, but can it actually cause acne? In this video, we're diving into the truth behind microneedling and acne. Hi, my name's Amanda Diven. I'm a clinical esthetician and acne specialist. I'm also certified in microneedling and have been performing this treatment for many years with phenomenal results on my own acne scars and my clients. Today, I'll be answering whether microneedling can cause acne, and I'll also be covering how you can prevent it, best practices post-treatment, and make sure you stay tuned until the end where I'll be covering microneedling alternatives for acne-prone skin. So first off, what is microneedling? Microneedling involves creating tiny, controlled punctures into the skin using fine needles. Microneedling boosts collagen production, which gives your skin that youthful and bouncy appearance. It's also amazing for treating any acne scars, pigmentation, fine lines, wrinkles, large pores, and texture. It's one of my absolute favorite treatments for treating any acne scarring. It's relatively painless when performed after numbing the skin and extremely safe when done by a professional. So, can microneedling cause acne? Yes, it can cause acne, but it's extremely uncommon. This usually happens when there's improper care after the treatment or when bacteria are introduced to the skin. You may experience acne after microneedling due to skin purging. This can happen anytime we speed up the cell turnover process in the skin. It's not that the treatment necessarily caused acne, it's that there was already acne underneath the surface that wasn't visible to the eye, and now it's working its way up to the surface, up and out. The second reason you could be experiencing acne after microneedling is due to improper hygiene or post-care. If you're not thoroughly cleansing your skin properly or using products that contain pore clogging or comedogenic products, those are more easily absorbed into the skin after a microneedling treatment. The third reason is you could have an inexperienced technician who doesn't know to avoid active acne when they're performing the microneedling treatment. It is possible to get a microneedling treatment done when you have a few active breakouts, but it's super important that the technician knows to avoid those areas. Imagine this, you're microneedling with little needles into the skin and you go over an active breakout, and now that needle carries that bacteria across your face for the rest of the microneedling treatment. So it's really important that they know to avoid those areas and how to perform it safely on someone who does have acne-prone skin. The fourth reason someone may get acne after a microneedling treatment is due to the increase in sebum production during the skin's healing process. Because we've caused trauma to the skin and your skin is a little bit dry, it might overproduce oil temporarily while it works to heal the skin. The fifth reason is using non-sterile equipment. Make sure your technician is using a new cartridge for every microneedling treatment. I actually have one right here so you can see what it looks like. And they just come in these little disposable packages. It's sterile, so the technician can use one at a time and then dispose of it and make sure you have a fresh one for your appointment. Most people would know this, but you never know. I've heard some scary stories out there. Just make sure that you have a technician that is properly trained and following the best hygiene practices. But don't worry, if you're following the right steps, you can avoid all of this. Most people who experience acne after microneedling are using the wrong products or skipping crucial post-treatment care. So let's talk about how you can prevent acne after microneedling. Here are my top tips for preventing acne after microneedling. Number 1, make sure you are changing your pillowcase before you go to bed. Your pillowcase can harbor tons of bacteria, and when you've just got a microneedling treatment done, we've just punctured tiny little holes into the skin, so we want everything that comes in contact with the skin to be super clean. Number 2, use a gentle cleanser with no exfoliating ingredients. All exfoliating ingredients should be avoided for at least 5 to 7 days after a microneedling treatment. Number 3, avoid heavy makeup or products that can clog your pores. If you're not sure what pore clogging ingredients are, I'll leave a link in the description of this lesson where you can go and check all of your makeup products and skincare products for pore clogging ingredients. Number 4, keep your skin hydrated with a gentle, calming moisturizer, ideally with something that has ingredients like hyaluronic acid or aloe vera. And number 5, use non-comedogenic products. Comedogenic ingredients are ingredients that have the potential to clog the pores for people with acne-prone skin. So make sure you're checking all of your products before you're applying them to your skin, especially after a microneedling treatment where the skin is more susceptible to these ingredients. Some other ingredients to avoid after a microneedling treatment are retinoids, AHAs, which are things like glycolic, lactic acid, or mandelic acid, BHAs, which is salicylic acid, as well as benzoyl peroxide. Pretty much anything that says acne fighting has salicylic acid or any of the ingredients I just mentioned, so watch out for that. And by the way, if you're getting value out of this video, make sure you hit the like button and subscribe if you want more videos like this. Tell me in the comments, are you going to get microneedling soon? Have you tried it before? I'd love to hear what your experience was like. Here's what to do if you experience breakouts after microneedling. Number 1, ice your skin. Ice works extremely well at reducing inflammation. It helps to speed up the healing process, as well as it's going to help to reduce any inflammation inside of that acne. Number 2, use soothing and hydrating gels, and double check that your moisturizer is non-comedogenic. Number 3, avoid picking and irritating the skin further. Scratching at dry skin or a new breakout is just going to introduce bacteria to the skin and may lead to further breakouts or inflammation, as well as it's going to take the skin a lot longer to heal. If you're concerned it might be an allergic reaction, it might be time to reach out to your dermatologist or doctor for more tailored advice. Next, let's talk about alternative treatments for acne-prone skin. If you have active acne, then microneedling may not be the best option for you. In my experience, it's a lot better to treat the acne first, and then once you have the acne under control, you can worry about pigmentation, scarring, and texture. You may want to explore alternative treatments like chemical peels, which can treat acne as well as other skin concerns. Or if you've been struggling with acne for a while and you're not sure how to clear it yourself, maybe you feel like you've tried everything, then I suggest you check out my online program, The Acne Solution. I've helped over 2,000 clients achieve clear and healthy skin, and I'd love to help you. I'll leave a link in the description for you. In short, microneedling can cause acne, but with proper aftercare and an experienced technician, it's easy to avoid. Be mindful of your skincare routine, and if you're unsure, consult a professional. I hope this gave you value, and if you like this video, be sure to check out my other videos on skincare and acne. And if you want to see what my day-to-day life is like, then head over to Instagram and let's be friends there. Thanks again for watching, and I'll see you next time. Bye!